500 million African children have been protected through routine immunization. The progress is undeniable. Since 2000, nearly 20 million measles-related deaths have been prevented. More than 500 million African children have been protected through routine immunization. In 2024 alone, 1.9 million lives were saved, and malaria vaccines are now being introduced in 25 of our member states' countries, a major scientific and public health breakthrough. But the report also issues a very clear warning. Progress is uneven, and in some places, really slowing. The COVID-19 pandemic increased the number of zero-dose children. That is, those children who have never received a single vaccine. Today, as I speak, 10 countries account for 80% of the zero-dose children in this region. This is a profound equity issue. A child's chance of survival must never depend on geography, conflict, or even climate shock.
I think the message remains clear: to protect the future generation, no child will be left behind. So, moving forward in our other story, East Africa has backed an initiative that boosts disease outbreaks in Uganda's refugee hosting directives or districts. And a new European Union supported this initiative in strengthening Uganda's ability to detect and respond to disease outbreaks, particularly in the refugee hosting districts facing growing pressure on the health services. The program is supported by the European Union and implemented by International Rescue Committee with medical terms. International is improving the pandemic preparedness through stronger surveillance, also community response systems and emergency planning in the 15 districts across the country. Health officials say that the initiative is already benefiting nearly 150,000 refugees and hosting communities while strengthening preparedness for outbreaks such as cholera, mpox, and measles. So, experts say that the investment is crucial as refugees inflows, climate shocks, and disease threats continue to test local health systems. Also, stakeholders say that the goal is not only faster outbreak response, but building stronger, more and resilient health systems to prevent future public health emergencies. So, in other news, Bukomansimbi residents in Uganda raised an alarm over the persistent clean water crisis. And in our public health news today, the residents in Bukomansimbi district in Uganda are raising a concern over the worsening clean water shortage, with many communities still relying on unsafe water sources that officials warn could increase the risk of waterborne diseases and other health dangers. Residents in these areas say that some families are forced to fetch water from shared sources, also used by animals, while others travel long distances to pay high costs for limited water, placing an added strain on already vulnerable households. Also, community leaders say that the crisis is affecting the health, livelihoods, and even education, as children spend hours searching for water instead of being in school. There are also renewed calls for urgent intervention as residents push for safe and reliable water systems to prevent diseases and further loss of life. Health advocates say access to clean water remains a critical public health issue, and improving water safety is essential for protecting the people in these communities. Moving forward in our next news, in the health news, the Katikkiro of Buganda, Charles Peter Mayiga, is calling for renewed commitment in the fight against HIV/AIDS, and this was said during the rally Buganda to sustain pressure in the fight for the HIV/AIDS disease. And he was urging communities to remain consistent in the prevention efforts and awareness. Also speaking during a run that was held in Chadonto following Kabaka birthday run. Mayiga, Charles Peter Mayiga, emphasized that the repeated action and continued public education remain critical in reducing new infections and keeping communities vigilant. Also, participants say that the event not only celebrated the Kabaka's birthday but also reinforced public health awareness, unity and collective responsibility in confronting what some leaders warn could be a resurging effect. Also, health advocates say that the message in this remained clear: sustained awareness, prevention and also community action are still essential in the fight of HIV/AIDS. Moving on, in our other news, the government of Uganda links rising fistula cases to teenage pregnancies, moves closer to the emergency care gaps. And in our maternal health news today, the Uganda Ministry of Health has said that rising teenage pregnancies and delays in accessing medical emergency obstetric care are contributing to preventable cases of obstetric fistula, prompting a renewed effort to strengthen maternal health services. Health officials say many of these cases can be prevented through earlier interventions, stronger referral systems, and improved access to reproductive health information, especially for adolescents. So, the government is also expanding support through investments in the health facilities, additional health workers, and also improved emergency obstetric care and in high-burden regions. Also, officials say that the response will focus on fistula treatment, survival support, and addressing the social and health system factors during the coordination. Also, health experts say that the broader goal is to reduce the preventable maternal complications and also improve the outcomes of women and girls across the country. And let's take a look at that video explaining how we can prevent fistula as a country.
Obstetric fistula is in fact an abnormal opening between a woman's genital tract and her urinary tract or rectum. And this situation is of course resulting in unrestrained leakage of urine or even feces. And other impact of course include urinary tract infections, sexual dysfunction, infertility, and psychosocial and emotional damages. We need to make sure that the first pregnancy is delayed so that the body of the girl or woman is matured before the pregnancy started, before the delivery, and making sure that the pregnant woman or girl have access to quality antenatal care until the delivery time and can have access to cesarean section when needed for an adequate and timely management of obstetric complication, in particular the obstructive labor. The obstetric fistula is curable, is treatable, and the surgical repair is shown to be very successful. So the key thing is really making sure that these women suffering obstetric fistula are not abandoned, they are well supported emotionally, psychologically, and also making sure that they go as soon as possible to look for surgical care in hospitals, and this can be done easily and with very good result.
Hope you've learned something from that video. As we said, the broader goal is to reduce the preventable maternal complications and also improve the outcomes for women and girls all over the country. We are still together watching Your Health Show. Let's take a short break and then we come back with more.